Hi, everybody. This is Dr. Carrie Lane, and I'm going to start a mini lecture for you today on inflammation. And we're going to talk about how the cells of inflammation influence disease processes at that very basic level. It's important for you to retain this information and carry it forward for future lectures, but also future nursing classes. So there's 4 types of hypersensitivity reactions, and these 4 types are pretty essential for you to know in a lot of different settings. Type 1 is an immediate hypersensitivity reaction. Its title kind of gives it away. It happens right away. Um, type 2 is cytotoxic. Type 3 is immune, and type 4 is delayed. And we're going to talk more about each of these here in just a few minutes. So, type 1 hypersensitivity reactions. I like to use some of the images that are in your textbook, and you may go back and see some of those. But I like to also break it down into the smallest parts possible. So when we look at step 1, what we're really looking at is an antigen. And that antigen is the first step that happens when a person has a hypersensitivity reaction. This antigen attaches itself to an antigen presenting cell and begins that process. Step 2 presents an antigen to a CD4 cell. You've heard about CD4 cells before. They're T helper cells, and they help with fighting off infections. But they also have some other functions that can be a little detrimental to the body as well. So one of those more detrimental functions is that once this APC cell has presented to the antigen to the CD4, then that CD4 cell releases cytokines. Cytokines are one of the big cells that have a role in inflammation. So it's an important cell type for you to remember. And we see in this case that cytokines provoke B lymphocytes. And by provoking, that does mean that it is more of a attack type of a function. And when that happens, those B lymphocytes change into plasma cells. This function together makes the plasma cells secrete IgE. IgE is one of the immunoglobulins that we have in our system, and when IgE is released, it lands on our mast cells, and that makes histamine be released. Now, a lot of times you think histamine might be a good thing, but histamine is actually what causes a lot of the inflammation in our body. So if we get bit by a mosquito and we get that little itchy bubble on our skin, right, a little bump, that is histamine and eosinophils. So the histamine and the eosinophils are drawn to that area, and that releases inflammatory mediators. Then the inflammatory mediators can cause other symptoms, and those are listed down here. Things like sneezing, itchiness, urticaria, which is hives, rhinorrhea is runny nose, conjunctivitis is watery eyes, and actually refers to a lot of other symptoms. It's pretty broad, but in this case, it means watery eyes, and then bronchospasm. And that is that type 1, that immediate reaction. It happens just boom. In some persons, it can happen really severely, and we can end up with really severe bronchospasms or airway constriction that causes severe respiratory problems. And in other times, it's just bothersome, sneezy, watery eyes, and a runny nose. So, what we have to be worried about is that more, um, while we might treat all of these, we have to be really worried about that anaphylactic or the real severe reaction. We see that more with bee stings, some medications, some food allergies. Then there can be some other reasons like blood or iodine that could be administered, or even the dye they use in MRIs. Anaphylactic reactions have a real rapid onset. They cause dyspnea. Dyspnea is a term that's used for shortness of breath. So you might also hear that or see it abbreviated SOB, shortness of breath. And that causes a tightness in the throat or the bronchioles, can cause bronchospasm. It can cause laryngeal edema. Um, we could have some feelings of apprehension, not feeling right, feeling really worried or nervous, tingling, swelling in the mouth, face, throat, and tongue, itching. And in really severe cases, we're going to have a decreased blood pressure, a tachycardia, and loss of consciousness. So an anaphylactic reaction happens very quickly. It happens with what you might hear is referred to as a sudden onset, and it can be quite severe. So anaphylactic shock occurs as well. An anaphylactic shock, a child who has already had a contact with an allergen at least once. And this is the most severe form of anaphylaxis. We're going to see a really similar process as far as the IgG antibody being released. A large amount of histamine will be released, and then we'll start to see some dilation and oozing of blood vessels, near irritated nerve endings, and airway obstruction. So this causes an eventual falling blood pressure, which causes a circulatory failure and breathing difficulty. The basic definition of shock is that we have a lack of oxygen to the brain. We have that because we have a poor blood circulation and or trouble breathing.